Hello, podcast fam. I am thrilled to share some exciting news. My book, Sow, Grow, Lead, is officially live on Amazon. This book is more than just my story of starting a nonprofit and building a peanut butter factory in Malawi. So trust me, the ups and downs of that journey are worth the read. It's also packed with practical strategies to help nonprofit leaders like you tackle challenges with clarity, courage, and a whole lot of heart. If you've ever wondered how to turn your vision into reality, navigate the inevitable hurdles, and build something meaningful, whether in your organization or in your own life, this book is for you. I'd be so grateful for your support in spreading the word. Grab your copy of Sow, Grow, Lead in the show notes and on Amazon today. Let's keep sowing seeds of impact together. Welcome to the Lead with Heart podcast, which is dedicated to nonprofit leaders who are passionate about making a difference. I'm your host, Haley Cooper, and I'm thrilled to have you join us on a journey of growth, inspiration, and transformation. At Lead with Heart, we believe that leading with heart means embracing empathy, compassion, and authenticity in every aspect of our work. It's about putting people first, fostering genuine connections, and creating a positive impact that goes beyond numbers and metrics. In the nonprofit world, it can often feel like we're carrying the weight of the world on our shoulders. The challenges are immense and the road can be lonely. But here, you're not alone. This podcast is a community where we support each other, share our stories, and learn together. Each episode will dive into personal and professional development topics tailored specifically for nonprofit leaders. From innovative fundraising strategies and effective team management to self-care practices and leadership insights, we're here to provide you with practical strategies that you can apply to your life and work. My goal is to empower you, elevate your leadership, and engage your heart in all that you do. I want to help you navigate the unique challenges of the nonprofit sector with confidence and resilience, so you can continue to create meaningful change in the world. So whether you're driving to a meeting, taking a break, or winding down for the day, tune in and join us on this journey. Together we'll discover what it truly means to lead with heart. Thank you for being here. Let's dive in. Hello, everyone. Welcome back to the Lead with Heart podcast. This is your host, Haley Cooper. And today we are joined by a nonprofit powerhouse whose career spans decades of impact, service, and heartfelt leadership. Welcome, Ron, to the podcast, who has spent over 30 years helping mission-driven organizations across healthcare, social services, and education raise more than $100 million to fuel their vital work. From the policy halls of Connecticut State Senate to the boardrooms of some of the country's most respected nonprofits, Ron brings a wealth of knowledge, a calm confidence, and a passion for people. After receiving a chronic lymphocytic leukemia, or known as CLL diagnosis in 2022, Ron did what great fundraisers do. He turned adversity into action, channeling his expertise to help the CLL Society raise critical funds and awareness. Ron now calls Florida home, where he lives with his wife and their dog, Juno. This episode is full of wisdom, actionable advice, and inspiring perspectives. So stay tuned and welcome Ron to the podcast.
Thanks, Haley.
Well, I would love to know a little bit more about your background and how you originally started in nonprofit work, and then what led you to doing the work you do today.
Back in 1980, I guess it was around early 1990s, I had been working in politics in Connecticut for several years in the Connecticut State Senate, and then as a lobbyist after that, and really felt like there's got to be something more useful I could be doing with my life. And I didn't really know anything about the nonprofit sector at that point, to be honest with you, and it wasn't a goal of mine, but I did have an opportunity to meet some folks who were working on a project to build a new children's hospital in Hartford, Connecticut. And it was an interesting project. I originally didn't even join the team really as a fundraiser. It was more of a management role in the foundation, working on systems and things like that. But very quickly joined the campaign team and got into the fundraising side of things. And I think that was 1994. Never really looked back.
Wow, that's amazing. And We've talked about advocacy on this podcast before. So how have you utilized your political background to influence the work that you do in nonprofits?
Quite a bit over the years. A number of the positions I held, even though they were largely development positions, included some aspect of government affairs. I spent a lot of time, especially when I was working for nonprofits in Connecticut, going back to the halls of the state capitol and advocating for legislation. At one point, I was working with an international organization, and part of my job was to develop a strategy for states to go to their state legislators and get funding on a state and local level. So it's a great background for me to have. It doesn't directly relate to fundraising or development per se, but anytime there's an opportunity to pursue a different source of funding for a nonprofit, it's good to have that skill.
Yeah, definitely. And it sounds like a lot of the work that you do has been in healthcare. And so how does philanthropy drive medical advancement and enhance patient care?
It's funny, I started in healthcare and I'm ending in healthcare and where I am now. In between, I did a lot of different things that were more along the lines of education and science. But I think I've always felt, and that was one of the reasons I was so excited about the original opportunity I had back at the Children's Hospital, that you really see the direct results of what you're doing. The funding, whether it's for programs or for equipment, it really makes a difference in people's lives. And we were initially, the Children's Hospital I worked for was a new organization. We were just being created out of pediatric units from different hospitals in the area. So there was so much opportunity to create new programs and fund those programs, and things like safety for kids, and not even just specific healthcare program, things that we were able to do to keep kids safer, be a little bit more proactive about children's health. And so we really got very involved in those programs and could really see the difference. And of course, now, where I am at CLL Society, it's even more direct. I think we do get some industry funding, but the funding that we get from our community and our development program right now really is almost entirely focused on the people that we serve and their families. We don't do any really broad-based fundraising to the broader community. We really focus on the people who know about CLL, have been affected by CLL, or know somebody who's been affected by CLL. And not surprisingly, that's a big enough community for us to raise a significant amount of money from.
Wow, that's amazing. And I think a lot of nonprofits can relate to that, right? That's why it's so important to get to know who your donors are, because in some way, shape, or form, they're going to have someone that has related to your mission. I remember when I was my last role in-house, I was working as the director of development at an organization serving children experiencing hunger and homelessness. And one of our main donors had experienced homelessness as a child, and he now ran a successful shoe business. And so he could relate to our mission, had a shared passion, and was one of our greatest ambassadors in terms of seeking out partnerships on behalf of our organization. And so I think it's, no matter what your mission is, it's about seeing what the stories are within the community and how those people can come together to serve your mission.
Yeah, it's definitely true. And it's one of the things that I've really come to appreciate about the work that we do is being able to connect with people around those stories. I remember when I was working on another project in Hartford, Connecticut, we were building a new science center. And as I started talking with people, it was amazing to find out how many successful adults had felt that their childhoods and their upbringing was very influenced by either by a science center in their community or a science teacher in their community, and that people really felt that led them to ultimately the career path they chose, whether that was as an inventor or an engineer or an entrepreneur. And they love talking about those stories. And that's what I found so interesting, was when you find that hot button that is of interest to someone, or they just really, they open up and they really get excited about sharing those stories.
Yeah, definitely. And you've helped raise over $100 million throughout your career. So what do you think separates a good fundraising from great fundraising, especially in today's changing landscape?
Oh, that's a really good question. To me, it comes down to being able to establish relationships with people and just have people trust you. I know there are a lot of organizations that are very process focused, and you have to make a certain number of calls every week, and you have to, very metrics driven. And I've never been that way because I always felt like I'd rather have 10 really good relationships with good donors than be making 100 calls to people who may or may not care who I am. And so it takes time to build somebody's trust and to build that relationship and to find out what really matters to them. So some organizations can work that way. Others, I know larger universities where they have large teams, they really need to rely more on the metrics. But for me, and especially with smaller nonprofits, I really feel like focusing on the relationships, focusing on the people that you're talking to, understanding them really makes a difference.
Yeah, and I think it comes back to understanding, yes, it is important to raise the dollar goal, but there's so much that goes into raising that dollar goal, right? And that it comes with relationship building, which, like you said, takes time to build trust and to see that return. And so it's helpful for nonprofits to have that full context, because I think when you don't, that's when the large turnover happens, right? Because you're so focused on the metrics, and sometimes it's impossible to meet those metrics based on the changing landscape. But if you look at the whole context of what it takes to fundraise, people will actually be able to meet their goals.
Yeah, I spent a number of years in between other positions doing consulting for nonprofits in Connecticut and the Northeast. And it was amazing how many times I would get a call from an organization where they were midway through their budget year and they were really struggling. They knew they weren't going to meet their goals. And they'd say, well, we need to put together a major gift program and start raising money in the next 60 days. And that's how major gift programs fail. Right, because you're finding people and you're immediately asking them without understanding what it is that they're interested in or without having time to build trust. And my response would always be, let's just sit down and talk about what your needs really are. Because as a consultant, I always wanted to set people up for success, obviously. And I wasn't going to put together a program for somebody that I knew wasn't going to move them towards success. So it is just very important for nonprofit boards and leadership, not just the development folks, but the people who are making the demands, the financial demands of the development team, to understand that if you really want to be successful, you've got to have a strategy that takes into account the donor's needs, the donor's expectations, and the process that is required to build those relationships.
Yeah, definitely. And you mentioned that a lot of the work that you do now with the CLL Society is focused on those who have been directly affected. So could you talk a little bit more about the importance of patient-centered funding initiatives and how they create lasting change?
Yeah, and I think it's helpful at this point to step back a little bit and just to let people know that I'm in this position because I was diagnosed about 3 years ago in 2022 with CLL. And, it's kind of a life-changing thing when somebody tells you that you have cancer. It's sometimes confusing with CLL because you're being told that you have cancer, but you don't need to treat it right now. Let's not do anything just yet. And people that's not what you expect when you're diagnosed with cancer. So it was a learning curve for me. And when I started looking and trying to figure out how do I learn more about this disease and what I'm supposed to be doing, CLL Society was the organization that seemed to have the best, most current, and most reliable information. So that's how I ended up connecting with the organization, and then a short time later ended up taking this job on. What that allows me to do is really connect with our donors on a very personal level, because I don't mind sharing my story. I know a lot of our donors don't either. And, we can talk about what we're going through, and it opens the door for me to talk about how can CLL Society be more helpful? What can we do to make your living with this disease easier? And that's where I think we get into the conversation of being patient-centered, that we're really focused on the conversations with our donors are really focused on what we're able to do to make their lives better or their families' lives better.
Imagine a fundraising partner that not only helps you raise more money, but also supports you in retaining your donors. A partner that helps you raise funds both online and on location, so you can grow your impact faster. That's DonorBox, a comprehensive suite of tools, services, and resources that give fundraisers just like you a custom solution to tackle your unique challenges, helping you achieve the growth and sustainability your organization needs, helping you help others. Visit donorbox.org to learn more. Yeah, that makes sense. And can you talk a little bit more about your own personal journey with CLL and how it has shaped your approach to fundraising?
Yeah, absolutely. First of all, like going back 3 years, it was the first time in all the years that I've been in development that I was at an organization that I really didn't feel very strongly connected to. I've been very fortunate in my career to have been able to work for organizations that I felt very personally connected to, that I really wanted to see succeed. So 3 years ago, when I received this diagnosis, it caused me to step back and say, okay, what do I really want to be doing? I was almost 60 and, really felt like it was the right time to be thinking about what do I want to be doing professionally? What do I want to be doing personally? And it made me realize very quickly that I didn't want to be in the role I was in. I wanted to be doing something that would be more fulfilling for me. So that initially was, at least in large part, driven by the diagnosis, or I may have come to that point eventually anyway, but I think it moved that conversation within my head up maybe a couple of years. And it allowed me to focus and to say, okay, there are 3 or 4 things that in the nonprofit world that interest me. One was Parkinson's disease, because my dad died from Parkinson's disease. That was something I felt like I could be very passionate about, but certainly CLL as well. And so I reached out to CLL Society, and it was good timing because they were also having conversations about wanting to grow the development program over the next few years. And in the conversations that I had early on when I was joining the organization, my diagnosis really helped me understand what I needed to do to communicate with the donors that I would be working with and what I can learn from them. I think that's more importantly. I've learned so much from this job, even 35 years into my development career, not only about CLL, which I knew I would learn, but also about interacting with donors, because now I'm in a very personal situation. I share something very personal with our donors.
Yeah, that makes sense. And I'm a fundraiser as well. And a lot of people who listen to this are fundraisers. What are some of the key characteristics in building those relationships with donors? Can you expand a little bit more on what that looks like?
Yeah, listening, certainly. Sometimes it's hard to know how much information to share or how much information somebody that I'm talking to is willing to share when you're talking about a medical diagnosis. So it's a careful listening process initially to try to figure out. There are some people who just like talking about their entire CLL journey from the day they were diagnosed, and other people, really only talk about it when they have a question or really only feel comfortable talking with their medical team. So for me, I find that's a common ground that I can use to build trust. But if I share too much or if I ask too much, that makes it harder to get to build trust. So it's a very careful listening process to try to understand, what somebody is willing to talk about. And sometimes there are people who are willing to talk very specifically about their caregivers, but not how their caregivers might feel about CLL, but not how they feel about it themselves. So I try to work around those conversations very carefully. Other than that, I think once that's done, most of the conversation is not that different. You're looking for ideas. Was somebody interested in funding research, or are they more interested in funding direct patient services? Those are the same kinds of conversations that you would have at any organization with donors, really.
Yeah, and I think a lot of people think, oh, if you're going to be a fundraiser, you have to do all the talking. But I think the listening is the most important part, because that's where, like you said, you learn more about your donor, more about their passions and interests, and then how to align your fundraising goals and your organization goals with their passions. And so you talked about some donors like to fund research and treatment breakthroughs. So can you talk about the direct impact of donor funding on those areas?
Yeah, donor funding for research at CLL Society until a couple of years ago. So everything that we raised was really focused on education and awareness primarily. And then also a couple of years ago, we got into advocacy as well. So we've been expanding, and that's our four pillars that we talk about: education, awareness, advocacy, and research are the things that we feel will make the most difference in people's lives. But from a donor or funding perspective, so much of what we do really relies on our donor funding. The research that we do is entirely donor driven. And we were very fortunate a couple of years ago, actually, to have one donor step up and provide several challenge grants for research in integrative medicine. So he's funding our second challenge grant now, and he funded an additional project last year. So we're on our third integrative medicine research project. And that really is the reason that he was interested in that was it's something that the pharmaceutical companies are not funding. Nobody else is providing funding because there's no way to make a profit off of telling people what foods are better to eat or worse to eat or what exercises are better. So that's something that's the kind of research that we felt if we weren't going to fund that specifically for CLL, then probably nobody would. And we've been able to put a lot of money into that, and we expect that to make a big difference. On the patient services side, we are able to provide additional services now, for example, different kinds of emotional support programs, living for a couple of decades with cancer that's treatable but not curable can be very emotionally straining for just about anybody. So there are our support groups that have expanded now. We've had support groups around the country, but now we've expanded for things like veterans who were exposed to toxins like Agent Orange in the military, which is known to cause CLL. We have special groups for people who have a very common specific story that they share.
Yeah, I had Susan from Pancakes for Roger on the podcast, and her father, Roger, passed away from exposure to Agent Orange, and she has an impactful story. And when we're talking about stories, obviously, when it comes to patient care, there are HIPAA laws and certain things that you have to abide by within any organization when it comes to ethical storytelling, but specific when it comes to healthcare, there are certain laws that you have to abide by. So how do you navigate that with telling impactful stories to your donors?
It's funny, when our patients share their stories, there are two very different views in terms of sharing information about CLL. We have a lot of people who are very eager to share their story because they really want to help us get the word out about CLL. And when they share their stories, obviously, we have all of the necessary releases, and we're very careful to work with them to make sure they're comfortable with any information that might be included in that story. And if there's anything that we feel might come back to haunt them in any way, we'll point that out and make sure that they're very comfortable with what's being released. But there are a lot of other people with CLL, and this is, I found interesting, who really don't want to talk about it at all. And there's a little bit of a stigma. Somebody who's still working, and maybe they're in a very visible role or a key role in their organization, a lot of people feel like having it known that they're living with cancer might be detrimental to their careers in some way. Mm. And honestly, there's some truth to that. There was a story I was reading out of, I forget if it was Rhode Island or Massachusetts, just a couple of months ago, about somebody in the school district who basically was forced to leave his job because he was treated so badly after it became public that he had CLL. Because CLL progresses slowly. So people started accusing him of faking the cancer because he wasn't losing his hair. They didn't see any obvious signs of him having cancer. So there were all kinds of accusations. And things like that do happen. And so it's understandable why people would want to keep their diagnosis to themselves. We see this even with more famous people. There are a lot of people that we know in the sports world and in Hollywood who have died from blood cancer, but they don't say what kind of blood cancer. They're always very vague about what the cause of death was when it's somebody who's well known. So we understand that, and for that reason, we are extremely cautious when it comes to how any information that we collect might be released, even donor information. If somebody says they want to be anonymous, That's really important, not just because they don't want people to know that they made a gift, but they don't want people to extrapolate that perhaps this person has CLL. So we take that very seriously.
Yeah, that story is heartbreaking to hear that someone was fired because of their diagnosis. And I think with the work that you do, hopefully not many people have to experience that.
But we hope so. I mean, I think the more we can talk, raise awareness and let people know what CLL is, why it's different, why you don't see somebody with CLL losing their hair or going through things that you do see with other types of cancer, the more we can help people understand that, the easier it will be.
Yeah, definitely. You are also a faculty member and you teach fundraising and nonprofit leadership. So, what lessons do you think every emerging nonprofit professional should walk away with?
Sure. And let me just clarify, I'm not currently, that was something that I did while I was living up in Connecticut. I was a faculty
Okay.
member in a fundraising program, and it was fascinating to me, and I really enjoyed it because I was teaching people from all over the country and even up in Canada. And I feel like I learned as much or more from them than they learned from me sometimes. But I always come back to the same thing, and people tell me I sound like a broken record sometimes, but it's about listening and it's about relationships. And those are the two most important words that I always try to communicate with people. If you want to raise money from individuals, you've got to keep that at the center of everything you do. I had a CEO one several years ago who was very outgoing and loved to talk with people and was a great speaker. And he asked me early on when I took the job working with him, he said, teach me. He said, I know a lot about a lot of things, but I don't know anything about fundraising. So what do I need to do? And he said, give it to me in one sentence if you can. I said, shut up and listen.
Mm.
And he understood because he was the kind of person that would go into a room, didn't matter who else was in the room, he would be talking 90% of the time. And he understood that's not how you build a relationship with donors.
Yeah, I think it's also getting comfortable with silence, right? I get really uncomfortable with silence and then I want to fill the empty space. And I think it's about listening and being okay with the pause in between conversation to allow your donor to think about the impact that they want to co-create with you.
Not every pause is an awkward pause, right?
Mhm.
Sometimes a pause is just an opportunity to process.
Yeah, definitely. So you have worked across sectors, like you said, healthcare, education, whole social services. What are the universal fundraising principles that apply across these sectors and what's unique to each space?
Oh, I always sort of minimize what's unique to each space a little bit. And the exception to that, I guess, is with healthcare, with the HIPAA and the privacy that's required. In terms of the fundraising itself, I always start from the same place. And this helped me a lot also when I was consulting and putting together development plans for a pretty wide variety of nonprofits, mostly smaller nonprofits. What's your core mission? What do you really need to do? What are you capable of? It goes back to the hedgehog principle from the book Good to Great. I don't know if you're familiar with that. I'm drawing a blank on the author, but the book Good to Great, that he talked about the hedgehog principle. And it really was about three overlapping circles, creating a little Venn diagram of what are you really passionate about doing? That's your mission. That's what nonprofits exist to do. What are you good at doing? That's an internal assessment of what do we have the skills to do. And the third is the financial driver. In the corporate world, that's where can we make the most money? In the nonprofit world, it's what are the things that we can do that our donors will support? And you look at the intersection of those things, and this is how I always approach development planning for nonprofits. And you build out from there. What are we good at? What are the drivers that get us out of bed every morning and wanting to go to the office? And then the development side of that would be, okay, now we know what this organization needs to be doing. How are we going to fund that? And when you do that, when you step back to that point and follow that process through, a lot of things come to light that you might not have realized. Different programs that donors might be interested in, or maybe things that you're doing now that you could shift to something that your donors might be more interested in. So there's that process is really important. And then, of course, on top of that is the donor process of how do you communicate that to your donors? How do you communicate that passion to your donors and give them the confidence that the things that you're passionate about are also things that you can do very competently? Because a lot of donors will give to an organization just because they feel very passionately about the mission. That's why you see the commercials on TV for the animal organizations where the sad-looking pets, right? And people want to give because they say, oh, I agree with that passionately. I don't want dogs and cats to have to live like that. But to people who have asked the question, what does that organization do with my money, and do they use it efficiently or effectively? Major donors, though, when you're talking to major donors in your community, they do ask that question, and you need to be able to respond to that.
Yeah, I just posted something about that on LinkedIn a couple weeks ago. I was on a grant committee and we were reviewing grants, and it was about, oh, well, this organization is too well funded, so why would our $20,000 be used? And I think that was the wrong question. I think the question is, how well can an organization steward your dollars? And how transparent are they with their financials? Because I've seen well-funded organizations be really bad stewards with their money, and really small organizations that are grassroots, bootstrapping it, be really good stewards. And so I think it's the question, like you said, that donors are looking for is, what's the impact that my dollar is going to make, and how are they going to steward my funds effectively?
Absolutely. I think the more we focus on the impact and real measures, I mean, there's a big difference between real impact and perceived impact. You can send out 100,000 mailers, or you send out mailers to 100,000 people containing useful information about their health. That doesn't mean that you've actually impacted anybody's life, versus a program that may only serve 100 people or 1,000 people, but they do it in depth and can really measure the change in those people's lives. But it's not just about numbers. It's about the depth of the impact and how well it can be sustained.
Definitely. As we wrap up our conversation, is there any key takeaways or things that you would like our listeners to know?
Yeah, I think, first of all, if anybody is interested in learning about CLL, the CLL Society has a terrific website at cllsociety.org. And there's a tremendous amount of information on that website that if anybody knows, if anyone's concerned or they know anybody with CLL, I encourage people to check it out. In terms of development, though, I think CLL Society is not unique, or unique in the sense that of how we're serving people with CLL, but there are so many different organizations serving different rare diseases or lesser known diseases. And it's really important for people to look at these organizations and ask questions if that's their interest, because there are some great organizations, American Cancer Society and lots of others, that do terrific work in the broader scope of cancer. Somebody has a very specific interest, look at the organizations that are 100% targeted towards whether it's multiple myeloma or CLL or these more rare cancers that really can have a very significant and very important impact on the lives of the people living with these diseases.
Yeah, definitely. And you mentioned your website. Is there anywhere else that people can follow along and get to know more about your work?
That's the primary place. We are very website driven in the sense that there's a tremendous amount of content on our website. We have an events page where people can see all the different webinars and things of that nature that we have coming up. There's a donate page, of course. We're a nonprofit, so if anybody wants to donate, that page is there as well. But I think the website is the best place for anybody to start if they really want to learn about our organization or chronic lymphocytic leukemia.
Well, thank you. And we'll make sure to link to all of that in the show notes. Thank you, Ron, for being on this podcast. I certainly have learned a lot, and I know our listeners will too.
Well, thank you. I appreciate the opportunity to join you.
If you have valued these stories or learned something from what you've heard, please share this podcast episode or follow me on LinkedIn. Thank you so much for your support, and together we can build a better community and world.